Hi, I'm Vicky. I work in Alton Street Surgery, Ross-on-Wye. I am reception manager and, more importantly, carers lead for the practice. In the practice as a whole, we look out for identifying carers. In our reception waiting room, we have a dedicated area to carers. There are leaflets that patients can pick up discreetly. Also, we mention carers on our internal calling board. We ask them to present themselves to reception, and then one of the receptionists would then go forward and discuss things. Going forward with carers, sometimes carers don't naturally present in the forms I've mentioned previously. Sometimes we will pick up on the reception desk people are struggling with administering medication, helping people with shopping. Appointments become a problem. We would then perhaps ask a question: do you care for this patient? How are you helping this patient? From that, people may call myself or one of the receptionists to come and have a private chat if that was necessary, or just sit in the waiting room with them with one of our carers' forms. At that point, I introduced to them that we would register them as a carer with the practice, and also with carers' support if that's what they required. We need to be aware that they are a carer because they have needs too, as well as the cared for. That's what's important. The reason we want to register them is because at the end of the day, they don't probably think about themselves. They keep going on day to day, caring, doing what's necessary, shopping. But for them, in surgery, if they're identified, we could offer them relaxation around the appointment system. They could come in when they've got someone to sit with the cared for. They can have a flu jab, they could have regular health checks, but we need to be made aware that they're a carer, because as soon as we are made aware, it opens up such a big world to them that they are recognised as a carer. They don't have to be on their own, and there's lots of support for them within the GP practice and other support agencies going forward.